So looking at the next artery right here, which we are trying to look at its clinical importance, and this is what is known as the lateral circumflex femoral artery. Okay, lateral circumflex femoral artery. So just like you see from the imaging, you can't even draw this artery without drawing, the femur. That's to show you that this artery gives what? Important blood supply to the femur. So the clinical importance include collateral circulation. So it gives up a lot of branches, and these branches connect with other arteries around that region, making sure that the blood supply is maintained, even if maybe there is injury or there's cut and all of that. So collateral circulation, it contributes to the cruciate anastomosis around the hip. It connects to the medial circumflex femoral and the inferior gluteal and the first perforating arteries. So as it is connecting with other arteries around that region, it maintains the blood flow there in the hip and the thigh, So it's very important of those arterial occlusion, trauma. Okay, so there's injury to any artery around the hip joint. This artery can also still come in. So of course, if I'm doing any surgeries around the hip, you have to be very cautious of this artery. You don't want to injure it. So its ascending branches contribute to the vascularization of the hip capsule. So it's very important in preserving hip, during all those surgeries. So sports medicine, it supplies muscles that are very involved in athletic activities. So if those muscles are injured, that person's athletic prowess is actually going off. So it's very important landmark too. You can trace it when you're doing all those surgeries, orthopedic surgeries and the rest of it. So surgeons use it as a guide when dissecting the thigh region to avoid any vascular injuries.